Let's discuss SALTER-Harris classification, which is put forth for physeal injuries most commonly occurring in children. Before we begin, we'll see some relevant anatomy. This is the metaphysis of a long bone and the end is the epiphysis. Between meta and epiphysis, we have epiphyseal growth plate, also known as physeal growth plate or physis. So SALTER-Harris classification will describe the grade of fracture occurring in children which involves this physeal or growth plate. This helps in prognosis and treatment. Type 1 SALTER-Harris classification, in which fracture extends directly through the growth plate, resulting in separation of epiphysis from metaphysis, like this. This may occur due to longitudinal force of injury. On X-ray can show normal or it can show mild soft tissue edema. The fracture is not apparent on X-ray. So remember this as slipped, and remember S. Example for this is slipped capital femoral epiphysis fractures. Coming to type 2 or above, remember A. Fracture line enters the plane of physis and exits through the metaphysis or extends above to the metaphysis. This is the most common type of SALTER-Harris fracture. The fracture looks something like this, extending through the physis and above till the metaphysis. So this triangular fragment is also called as Thurston-Holland fragment. We have the third type, in which the fracture line enters the plane of physis, exits through the epiphysis or extending lower to the epiphysis. Remember lower and L. It may involve the articular surface like this. Example for this is Tilloch's fracture of ankle. Coming to type 4, SALTER-Harris type. Remember through or transverse. These fractures cross the physis, extend through the epiphysis and also metaphysis, like this shown in this image. Type 3 and type 4 have more risk of growth retardation and urgent management is required in such cases. Then we have the fifth type or erasure type, remember ER for the mnemonic sake, in which the fracture line is caused by crush injuries at the physis as a result of compressive forces, and it causes erasure of the growth plate or complete injury of the growth plate. Happens in electric shocks, frostbites, irradiation cases. X-ray, it may not be seen, so it's radiographically occult. They can be physeal widening on X-ray. See these fractures on X-ray. This is type 1 involving only physeal plate. Type 2 extending from physeal plate above to metaphysis. Type 3 extending lower to the epiphysis. Type 4 extending to epi and metaphysis. Type 5, which is a crushed injury type, can be radiographically occult and is seen on MRI as physeal and marrow edema. Let's revise the common types, then we'll go to the rare types. This is type 1, S for slipped. Type 2, A for above. Type 3, L for lower extension. Type 4, T for through all. Type 5, ER for erasure of growth plate. So this will spell out as SALTER, stands for SALTER. So the mnemonic to remember 5 types is SALTER. Now we'll come to the rare types. Type 6, where there is injury to only perichondral structures. Type 7, where there is isolated injury to the epiphyseal plate only. Next, type 8, in which there is isolated injury to the metaphysis. And type 9, where there is injury to the periosteum only. Please subscribe to our channel and follow us on both YouTube and Instagram for more such exam related videos. Thank you.